Chapter 8, Communication Skills, Medium for All Nursing Practice. Question. A patient says to the nurse, I dreamed I was stoned. When I woke up, I felt emotionally drained as though I hadn't rested well. Which comment would be appropriate if the nurse seeks clarification? Answer is, can you give me an example of what you mean by stoned? The technique of clarification is therapeutic and helps the nurse examine the meaning of the patient's statement. Asking for a definition of stoned directly asks for clarification. Restating the patient is uncomfortable with the dream's content is parroting a non-therapeutic technique. The other responses fail to clarify the meaning of the patient's comment. Next, a patient diagnosed with schizophrenia tells the nurse, the CIA is monitoring us through the fluorescent lights in this room. Be careful what you say. Which response by the nurse would be most therapeutic? Answer is, it sounds like you're concerned about your privacy. It is important not to challenge the patient's beliefs, even if they are unrealistic. Challenging undermines the patient's trust in the nurse. The nurse should try to understand the underlying feelings or thoughts the patient's message conveys. The correct response uses the therapeutic technique of reflection. The other comments are non-therapeutic. Asking to talk about something other than the concern at hand is changing the subject. Saying that the CIA is prohibited from operating in healthcare facilities gives false reassurance. Stating that the patient has lost touch with reality is truthful but uncompassionate. Next, the patient says, my marriage is just great. My spouse and I usually agree on everything. The nurse observes the patient's foot moving continuously as the patient twirls a shirt button. What type of communication is the patient presenting? Answer is mixed. Mixed messages involve the transmission of conflicting or incongruent messages by the speaker. The patient's verbal message that all is well in the relationship is modified by the nonverbal behaviors denoting anxiety. Data are not present to support the choice of the verbal message being clear, explicit, or inadequate. Next, a nurse interacts with a newly hospitalized nurse. Which nursing statement reflects the communication technique of offering self? Answer is, I'd like to sit with you for a while to help you get comfortable talking to me. Offering self is a technique that should be used in the orientation phase of the nurse-patient relationship. Sitting with the patient, an example of offering self, helps build trust and conveys that the nurse cares about the patient. Two incorrect responses are ineffective and non-therapeutic. The other incorrect response is therapeutic but an example of offering hope. Next, which technique will best communicate to a patient that the nurse is interested in listening? Answer is, restate a feeling or thought the patient has expressed. Restating allows the patient to validate the nurse's understanding on what has been communicated. Restating is an active listening technique. Judgments should be suspended in a nurse-patient relationship. Close-ended questions such as, did you feel angry? Ask for specific information rather than show understanding. When the nurse simply states that he or she understands the patient's words, the patient has no way of measuring the understanding. Next, a patient discloses several concerns and associated feelings. If the nurse wants to seek clarification, which comment would be appropriate? Answer is, am I correct in understanding that? Asking, am I correct in understanding that, permits clarification to ensure that both the nurse and patient share mutual understanding of the communication. Asking about common elements encourages comparison rather than clarification. The remaining responses are implied questions that suggest the nurse was not listening. Next question. A patient tells the nurse, I don't think I will ever get out of here. Select the nurse's most therapeutic response. The answer is, you don't think you're making progress? By asking if the patient does not believe that progress has been made, the nurse is reflecting by putting into words what the patient is hinting. By making communication more explicit, issues are easier to identify and resolve. The remaining options are non-therapeutic techniques. Telling the patient not to talk that way is disapproving. Saying that everyone feels that way at times minimizes feelings. Telling the patient that good work will always result in success is falsely reassuring. Next, Documentation in the patient's chart shows throughout a 5-minute interaction, patient fidgeted and tapped left foot periodically, covered face with hands, and looked under chair while stating, I enjoy spending time with you. Which analysis is most accurate? Answer is patient's verbal and nonverbal messages are incongruent. When a verbal message is not reinforced with nonverbal behavior, the message is confusing and incongruent. Some clinicians call it a mixed message. It is inaccurate to say that the patient is giving positive feedback about the nurse's communication techniques. The concept of a cultural filter is not relevant to the situation. A cultural filter determines what a person will pay attention to and what he or she will ignore. Data are insufficient to draw the conclusion that the patient is demonstrating psychotic behaviors. Next, while talking with a patient diagnosed with major depressive disorder, a nurse notices the patient is unable to maintain eye contact. The patient's chin lowers to the chest while the patient looks at the floor. Which aspect of communication has the nurse assessed? Answer is a nonverbal communication. Eye contact and body movements are considered nonverbal communication. Insufficient data are available to determine the level of the patient's social skills or whether a cultural barrier exists. Next, during the first interview with a parent whose child died in a car accident, the nurse feels empathic and reaches out to the patient's hand to take the patient's hand. Select the correct analysis of the nurse's behavior. Answer is the gesture is premature. The patient's cultural and individual interpretation of touch is unknown. Touch has various and individual interpretations. Nurses should refrain from using touch until an assessment can be made regarding the way in which the patient will perceive touch. The other options present prematurely drawn conclusions. Next, a school-aged child tells the school nurse, other kids call me mean names and will not sit with me at lunch. Nobody likes me. Select the nurse's most therapeutic response. The answer is, tell me more about how you feel. The correct response uses exploring, a therapeutic technique. Distractors give advice, a non-therapeutic technique. Next, an African American patient says to a Caucasian nurse, there's no sense talking. You wouldn't understand because you live in a white world. What would be the nurse's best action? Answer is, say, please give an example of something you think I wouldn't understand. Having the patient speak in specifics rather than globally helps the nurse understand the patient's perspective. This approach helps the nurse engage the patient. Next, a Filipino American patient avoided eye contact when interacting with the nurse. The nurse concluded that the patient had low self-esteem. Interventions were used to raise the patient's self-esteem. However, after 3 weeks, the patient's eye contact did not improve. What is the most accurate analysis of this scenario? Answer is, the nurse should have assessed the patient's culture before concluding the patient had low self-esteem. The amount of eye contact in which a person engages is often culturally determined. In some cultures, eye contact is considered insolent, whereas in other cultures, eye contact is expected. Asian Americans, including persons from the Philippines, often prefer not to engage in direct eye contact. Next, when a female Mexican American patient and a female nurse sit together, the patient often holds the nurse's hand. The patient also links arms with the nurse when they walk. The nurse is uncomfortable with this behavior and thinks the patient is misunderstanding the nurse's patient relationship. Which alternative is a more accurate assessment? Answer, the patient is accustomed to touch during conversations, as are members of many Hispanic subcultures. The most likely answer is that the patient's behavior is culturally influenced. Hispanic women frequently touch women they consider to be their friends. Although the other options are possible, they are less likely. Next, a Puerto Rican American patient uses dramatic body language when describing emotional discomfort. Which analysis most likely explains the patient's behavior? The answer is, belongs to a culture in which dramatic body language is the norm. Members of the Hispanic American subcultures tend to use high affect and dramatic body language as they communicate. The other options are more remote possibilities. Next, during an interview, a patient attempts to shift the focus from self to the nurse by asking personal questions. How should the nurse respond? The answer is the time we spend together is to discuss your concerns. When a patient tries to focus on the nurse should refocus the discussion back onto the patient. Telling the patient that interview time should be used to discuss patient concerns refocuses discussion in a neutral way. Telling patients not to ask about the nurse's personal life shows indignation. Saying that nurses prefer to direct the interview reflects superiority. Saying you've turned the tables on me states the fact but does not refocus the interview. Next, which principle should guide the nurse in determining the extent of silence to use during patient interview sessions? Answer is silence can provide meaningful moments for reflection. Silence can be helpful to both participants by giving each an opportunity to contemplate what has transpired, weigh alternatives, and formulate ideas. A nurse breaking silences is not a principle related to silences. Saying that patients withdraw during long silences or that silence helps patients know that they are understood are both inaccurate statements. Feedback helps patients know they have been understood. Next, a patient is having difficulty making a decision. The nurse has mixed feelings about whether to provide advice. Which principle usually applies about giving advice? Answer is it is rarely helpful. Giving advice fosters dependence on the nurse and interferes with the patient's right to make personal decisions. Giving advice also robs patients of the opportunity to weigh alternatives and to develop problem solving skills. Furthermore, it contributes to patient feelings of personal inadequacy. It also keeps the nurse in control and feeling powerful. Next, the relationship between a nurse and patient as it relates to status and power is best described by which term? Answer is complementary. When a difference in power exists as between student and teacher or nurse and patient, the relationship is said to be complementary. Symmetrical relationships exist between individuals or like or equal status. Incongruent and paralinguistic are not terms used to describe relationships. Next, a patient with severe depression states, God is punishing me for my past sins. What is the nurse's best response? Answer, you sound very upset about this. The nurse reflects on the patient's comment, a therapeutic technique to encourage sharing for perceptions and feelings. The incorrect responses reflect probing, close-ended comments, and giving advice, all of which are non-therapeutic. Next, a patient cries as the nurse explores the patient's relationship with a deceased parent. The patient says, I shouldn't be crying like this. It happened a long time ago. Which responses by the nurse will facilitate communication? Select all that apply. Answer is, I can see that you feel sad about this situation. The loss of your parent is very painful for you. Crying is a way of expressing the hurt you're experiencing. Reflecting and giving information are therapeutic techniques. Why questions often imply criticism or seem intrusive or judgmental, and they are difficult to answer. Changing the subject is a barrier to communication. Next, which benefits are most associated with the use of telehealth? Select all that apply. Cost savings for patients, maximization of care management, and access to services for patients in rural areas. Use of telehealth technologies has shown that they can maximize health and improve disease management skills and confidence with the disease process. Many rural patients have felt disconnected from services. Telehealth technologies can solve these problems. Although telehealth's improved health outcomes regularly show cost savings for payers, one significant barrier is the current lack of reimbursement for remote patient monitoring by third-party payers. Telehealth is not associated with rapid development of trusting relationships.